solid spinal cord all the way down to the conus modularis. This is the cauda equina. All the way down to the very end is going to be the filum terminale. You also have the cervical enlargement and the lumbar enlargement. Then you go into the cervical, where is it? Here it is. About C1 through about C4 or 5 is the cervical plexus, and here is the phrenic nerve coming off. This is the brachial plexus, superior, middle, and inferior trunk. Don't worry about the nerves in the arm because we'll get that on the other one. And then come down here and you'll see this is the lumbar plexus that feeds into the femoral nerve. Here's the sacral plexus, which feeds into the largest nerve in the body called the sciatic. When you come back up here again, you're going to make me dizzy, you can actually see these are ganglia. These are what they call parasympathetic ganglia. Way down here in the parasympathetic ganglia, and everything between in the thoracic area are the sympathetic chain ganglia. These little structures here are the denticulate ligaments that attach the spinal cord to the inside of the vertebral canal. This is a dorsal root, that's the ventral root, and it comes out into a spinal root. These are called rami communicantes. This is the dorsal and ventral roots, actually dorsal and ventral rami, excuse me. These are the intercostal or thoracic nerves. They can ask you things like psoas muscle, iliacus muscle, lumbricalis muscle. These are going to be the scalene muscles, things like that. That's it for this. So let's, who has that other, oh here.
Oh. Beautiful.
This one here is a little, since it's similar, let's go ahead and go through this.
Sorry,
So
Natalie,
again,
that I'm
they
so
could ask you some things on this, like cerebellum. This could be gyri. This could be the sulci. You have the central sulcus, the transverse sulcus, and that's about it for that. Spinal cord, same thing. Cervical enlargement, lumbar enlargement. Cervical plexus, here is the phrenic. Brachial plexus, and you have one that comes all the way down here and wraps underneath is the axillary. One that comes out to the side here and here is the musculocutaneous. This going to the radial side, so that's the radial, median, and ulnar nerves. Over here it's a little different. As you come from the axillary on the left, you'll see that the radial starts off on the lateral side, crosses over to the medial side. Radial, and that's going to be the ulnar because the hand is rotated internally. The lumbar, you can see, starts here and comes all the way down to about here. This is the femoral, goes all the way down, and it bifurcates on the back, so you have tibial, deep and superficial, perineal, or fibular. And when you go this side, you have the sciatic, comes all the way down through here, and bifurcates into the anterior tibial, posterior tibial, and fibular. And conus modularis, cauda equina. What's this one? Filum terminale. And what does it anchor at? Coccygeal ligament. Exactly. Okay, that's it for this.
Every time I move, I'm like,
Where's that transverse? Let's see this. Okay.
where you going?
This thing can ask you anything because you've already had it. Normally they're going to focus just on the following. So let's start on the outside and work our way in. You have the dura mater, which is the outside gray structure that covers all of this is all dura mater, the gray structure. And then the inside layer is going to be the arachnoid, that layer right there, that layer, and so on. In between the in between the arachnoid and the pia, which lays right on the neural tissue, is the subarachnoid space. Let's finish through this. So you have the white matter, the gray matter. This is going to be the ventral white column, the lateral white column, the dorsal white columns. They call them columns because these are ascending and descending tracks. When you get into the gray horns, this is the anterior gray horn, lateral gray horn, posterior gray horn. The gray commissure connects, central canal is right down through the center. This is the anterior median fissure because it's larger than the posterior median sulcus. All right? These are referred to as, well, ventral and dorsal rootlets, which lead into the ventral and dorsal roots, which lead into the spinal nerve itself. This large structure here that's on the dorsal root is the dorsal root ganglia. Let's see. This is the rami communicantes. This is the sympathetic chain ganglia. This is the dorsal rami.
Do we have to say
Say that again?
white?
No, white can't really tell. Can't tell on this one. That's about it. They could ask you maybe a little bit about this. This would be, here's the dura mater, here's the outside, in between is the epidural area, the epidural structure. Beyond that, that's about it. Just know that this is a cervical vertebra because you have a transverse framing. Superior articulating bifid spinous process, stay, and the body. Okay? Good.
Next. Right here.
You get all this? Okay. Are there microphones in here?
Do you want to pull that microphone out?
Oh, this one here?
Yeah.
Yeah, put it here. Stay. Okay. This is a model of a neuron. So you actually have the axon. These structures that are gray coming off of the soma are dendrites. These structures that are brown are actual synaptic buttons, terminals of other axons that are coming and attaching. Don't get confused. These are not dendrites. Only the gray portion is a dendrite. Inside the soma, you see these blue structures through here. This is all mesobodies. Here is the initial segment, which makes up the axon helix. You can actually see right here, they're broken down, that here's a kind of a neuro-neural junction right here, and so on. When you take this, you come right over here. So this is like a continuation to here. So this whole area here is the axon. And they could ask you that blue line on the outside there is referred to as the axolemma, which basically like the plasma lemma or the axolemma. That's the outer lining that goes over the actual axon. These are some of these are mesobodies, some of these are mitochondria. This white area is layered in layers of myelin, and this is what we refer to as a Schwann cell. So what the question is, they could ask you to identify this. You'd say it's actually called a neurolemmacyte, but it's also a Schwann cell. Then they can ask you, in what system would you find this neuron? Say that.
Nervous.
Thank you. Which one of the nervous systems would you find it in? Peripheral or CNS? It would be in peripheral because Schwann cells or neuroglias in the PNS, not the CNS. If it was an oligodendrocyte, then it would be in the CNS. Then this area right here that you see here and you see here are referred to as the nodes of Ranvier. Then this is the endoneurium. It's the area that goes around the actual axon. Then there's the perineurium, which goes around the fascicle, and then the epineurium, which goes around the entire nerve fiber. And that's all you need to know this. The axon helix it's actually referred to as the hill. So it's when the axon comes close to the soma and begins to expand. It actually looks like a hill. This area here is called the initial segment, which involves the axon helix. The initial segment is actually what institutes or initiates the action potential to send the impulse down the axon. What does it have there?
How about the tongue? Where's the tongue?
There's what?
The tongue.
We'll get let's finish the nervous system.
Oh.
I don't know if you guys are going to be able to see this upside down, but drop this over here. Okay.
Yeah, I'm tired.
Good stay, okay. All right. Being that this also shows the oral cavity and the nasal cavity, they could ask you possibly some special sentence questions. So let's go through the basic information, then we'll go to those. So here you have the dural sinus, which basically is where the cerebrospinal fluid is going to flow within the subarachnoid space. Here you see the gyri and you see the sulci as well. Then you have the corpus callosum, septum pellucidum. This whole area in here, all the way around here, is the third ventricle. On the roof of the third ventricle, you have the choroid plexus, which secretes what? Cerebrospinal fluid, which is produced by what neuroglia cell? Epidermal cells. Thank you, Stephanie. All right. Then don't worry about this little pink area here. It leads to this gland, which is the pineal gland. And then